And like I said before, motivational interviewing is one of my favorite topics. And actually, it was one of my favorite trainings to go to, which says a lot because I love to learn and I've been into several trainings. But I think one of the things that brings me to it is is actually related to the information that was presented earlier, is how patient-centered it is, how human-centered it is, and how viewing behavior change, health change as not just within the individual, although that's one of the most important things that I'll be talking about today, but also within the community that supports that individual, including the practitioners and their surroundings socially as they go home to put these health behaviors into practice. Okay, and so my hope is that as I share my slides and my knowledge with you today, that I'll demonstrate the fundamental spirit and principles of MI, that I'll help with understanding of those core communication skills, or ORs. We'll talk about those more, to elicit and reinforce change talk. Also to learn to identify change talk, listen for it in our patients, as well as sustain talk and find ways to elicit and reinforce change talk and reduce that sustained talk, or that talk about staying the same. Recognizing signs for readiness to change, and then developing ways to help with effective change plans in a motivational interviewing consistent manner. So Miller and Rolnick, the originators of motivational interviewing, give the definition that motivational interviewing is collaborative. It's goal-oriented style of communication with particular attention to the language of change. And it's designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. So really seeing the person with you as the expert on themselves and what could work for themselves, while we may, as healthcare providers, be the experts of the information that we have, whether that's about diabetes or other healthcare health issues. The person is going to be the expert on what's going to work for them. So while we might start with a common goal of, for example, changing health behavior or improving health, the person and the provider work on that common goal. The specifics of how that goal happened may be more within the patient's purview based on the information, the expert information that we can provide as healthcare providers. The next thing that I want to talk about are the two major components of motivational interviewing skills, and that would be the skills and the spirit. So starting with the skills, basic communication skills are asking permission, and then the use of ORs, or open-ended questions, affirmations, reflections, and summaries. And by asking permission, we're inviting that collaboration with the patient. So for example, would it be okay if we talked about the impact of diabetes on your health today? Through open-ended questions, we're gathering that information that helps us understand the background and what this diagnosis means to the patient. We're understanding more about their community, their beliefs, their values. So we learn more about the patient through open-ended questions, such as, what thoughts do you have about making changes to improve your health? Through affirmations, we're providing information to the patient about their strengths, ability, and efforts, what we see that they're doing that really benefits their health. When I thought about affirmations early on, I used to think of them as praise, and I would often give an affirmation as, I really love how you're making exercise a part of your life, for example. But now I see affirmations more about appreciating what the person is doing for themselves. And so I encourage learners to start with you rather than I. So saying something more like, you've been successful with adding a physical activity into your day, because that ownership belongs with the person who made that happen. So affirmations, once again, about strength, ability, and effort, but recognizing it's the person that's making that happen and encouraging that behavior for them. reflections are actually where we want to spend most of our time in motivational interviewing. So the typical idea is that we want 3 reflections for every one question, which can be a hard skill to master when you're doing motivational interviewing. And you also have a lot of other information to obtain from the person that you're working with. But reflections allow for that elaboration of key points requiring follow-up. Reflections are also great because it allows the person to listen to what they've presented to you, listen to you give back the information that they shared in your voice. And then they get to think about that. Wait a second, is that really true for me? So some mental work in listening to what they've shared and hearing what they've shared given back to them. So an example of a reflection might be something like making changes in what you eat is the most difficult for you, and you're trying to figure out a way to enjoy your meal and make it healthy. Summaries are ways of shortening time. So it's a good way to wrap up if it's a busy day and you have to move forward, and you also have already talked about some steps that could happen to help with health. It also restates key information that you've gathered during that conversation while asking the open-ended questions and confirming your understanding of that. So a good summary might start with something like, let me stop here and make sure I understand. You don't think your diet is unhealthy, but the lab results do worry you. And you do think there are some things you'd like to improve, like eating more fruits and vegetables. Is that right? And then by asking them about that, you can move forward. And before I move on from the skills, I love to visualize it in this way. So we think about it as a field that has weeds and beautiful flowers. And so our conversation is like that. It's like that field that has a bunch of weeds, but also some really beautiful flowers. And as we're listening to the individual talk, we start collecting those beautiful flowers, those things that they're already doing to take care of themselves, those goals and values that they have for themselves. And then we present it back to them verbally in just a beautiful bouquet, and see and organize it for them, and then see where that takes them and where they want to go from there. And as you can see, it also might enhance their self-esteem, because a lot of times when people show up to see us as healthcare providers, especially in specialty care areas, they've had a lot of failed attempts at change. And much like the early adherence for such a long time with a chronic disease can be really difficult. So presenting them with a bouquet of what they've already done that's amazing for their health is a really good way to start to enhance the relationship, and then start them on a good foot of having more confidence in themselves. The skills are actually one of the more important aspects of motivational interviewing. So while many people focus on ORs and talk a lot about open-ended questions and reflections and affirmations, Milner and Rolnick say that focusing on the skills of MI without the spirit is like focusing on the words of a song without including the music. So the spirit of MI is often seen as the most important part, and it includes 4 pieces. First, collaboration or genuine partnership that's created where the person, again, is the expert on themselves, and the provider offers expertise through gentle guidance rather than being directive. So it's 2 experts working together collaboratively. Second, the person is accepted as a human being with strengths. So acceptance becomes important. The person we work with is definitely able to make change, and probably is really aware of the hows. You know, we have so many magazines and websites and that sort of thing that tell us about the hows. It's really understanding more about the whys and working on the whys to make those changes. Compassion, or working with the person in a non-judgmental, non-blaming way, non-shaming way, and striving to be as sympathetic as possible when we work with them. And actively promoting their welfare in all ways is essential to the spirit of motivational interviewing. And finally, evocation, or the idea that the person already has everything within them to make the changes. It's just our job as providers to bring that out. Once again, I want to talk about gentle guiding. Gentle guiding is sort of like that best teacher that you've ever had. You know, do they tell you the answer? Not necessarily, but they're there by your side and talking with you about your choices. And in that, you have the freedom to make the best choices for yourself. I love memes and collecting memes about specific topics that I work on. And this one speaks to me about the spirit of motivational interviewing. So if an egg is broken by an outside force, life ends. But if broken by an inside force, life begins. Great things always begin from the inside. I also want to share a picture of my daughter because when I snapped the shot, I thought, oh my goodness, this is what I think about a lot of times with behavior change and especially related to motivational interviewing. On the left side of your screen, you see her before her first dance class, apprehensive, anxious. Where am I going? What am I going to do? This is a new place for me. It's new territory. My mom's going to be behind a one-way mirror and I'm going to be with a bunch of strangers, even though she really loved and wanted to learn to dance. On the right, you see her after class, where she went, she did it, she made friends, she felt accomplished. And I feel like this is what we hope for our patients. That is, for as much apprehension, concerns, and worries that they might have for their health, that they can come out of practicing better healthcare, feeling really confident and good about themselves. There is a ton of empirical evidence for motivational interviewing. It's over 30 years of research evidence, primarily in the adult populations, but focusing on the effects of patient health and satisfaction. The effects of MI are often maintained from 3 to 24 months after the intervention. There's also the impacts are across age, gender, and ethnicity. So it's really an application that can be applied to many diverse populations, which probably is why the motivational interviewing network of trainers is an international network, because we know that that works for all sorts of individuals. It also can be delivered in less time than other counseling strategies. So often tagging on 2 to 3 minutes, like Ambika mentioned, and it has comparable effects to other interventions. So it's actually been compared to counseling strategies such as cognitive behavioral therapy and has had similar impact. When we think about research in pediatrics, we see that it's not extensive, but it's empirically supported and has been shown to improve adherence, reduce risk-taking behaviors, and enhance the patient and provider relationship while promoting that behavior change. One of the reasons, one of the main things I talk to learners about is how even if someone comes into your office and you practice motivational interviewing and assisting them with health change, even if they leave without agreeing to make those changes, they have established a relationship with you and they know where to come back when they want to make those changes. So if you are doing motivational interviewing with that spirit, they're going to appreciate what you bring to the table and what you provide to them and can come back when they are ready. The primary areas of research interest have been substance abuse in teens, contraception, weight management, which is related to our talk today, and adherence for children and adolescents with chronic illness. There are 4 processes of motivational interviewing. First, engaging. Shall we work together, creating that relationship, that collaboration? And then we want to focus. So unlike sometimes feedback I'll get about motivational interviewing is that it's not directive. Well, we don't direct the patients on what to do. We do help them focus on one particular behavior that will work or area to change that will work for them. We also work on evoking, once again, that gentle guidance of why change, maybe providing some expert information about how that change could impact their life in a positive way. And then we work together on planning. So in thinking about all this, how can we provide, how do we do this? How do we provide this? How do we learn this? Well, there's lots of other opportunities than just today, but I'm going to provide you a brief overview of what's out there. And I think part of it is just saying, I want to make this change. I want to do this a little bit differently, and trying it out and seeing where it gets you. But in order to implement MI in pediatric settings, we need to think about training. So first we start at a basic level with knowledge. So we know that the learner has to acquire the knowledge. So what is MI? How does that work? What are the skills? What are the spirit? And then we add that into our practice. We try it out. We have opportunities to help us enhance and hone our learning in different settings. And then we also get feedback that builds our skills, and ultimately confidence comes along. So for MI, a little bit of knowledge about how to apply it can actually go a long way. And as just mentioned earlier, just one visit can have an impact on behavior change in different health areas. One of the things I love about MI is seeing the increased confidence. As you guys might know or be familiar with, when you explore the literature on healthcare providers and confidence in counseling, sometimes that's not always present. But by trying out MI and learning MI, then we can have increased confidence that we're using something we know can work for our patients as we move forward. And we can have that experience of seeing it work, which is even more, just genuinely a great experience. Another meme, so actually this is the words of an Alaskan elder who was reflecting on what he had learned about motivational interviewing in a workshop that was provided by one of our trainers. So MI, motivational interviewing with someone, is like entering their home. One should enter with respect, interest, and kindness, affirm what is good, and refrain from providing unsolicited advice and rearranging the furniture. So I want to talk just a bit about focusing, because I do think sometimes it's difficult to work in the context of motivational interviewing without having a focus. Sometimes that focus is, it can be something that you feel as a practitioner would be a good focus to talk with your patient about, but you want to ask permission to do that. So saying something like, would it be okay if we talked a bit about and present the topic of interest that you think would benefit their health the most? And if the patient agrees, then you can have a conversation and provide the information that you think might be valuable to them in making change. The other thing you can do is elicit the person's agenda. So after reviewing the forms you filled out today in clinic, I see that you're reporting you're doing well in this, and this area, but there are some areas that could be giving you trouble, like here and here. And what would you like to talk about today? So you could present it verbally. I also like the idea of presenting a menu, so common things that you could talk about in your clinic. And sometimes having that available can really help start conversations, maybe even conversations the patients didn't know that they could have with you. Oh, we can talk about this because this is something that I've really been struggling with. And so I'm going to give you an example. This comes from a book called Motivational Interviewing in Nutrition and Fitness, which if you haven't explored that, it could be really valuable in the area of, especially in the area of diabetes and weight management. And this particular circle chart is for nutrition and fitness counseling. And you can see the areas offered there, talking about beverages, like the sugar sweetened beverages, or eating more regularly throughout the day. So there's lots of different areas. You also see on the slide that there's a blank spot. So you could add something, or the patient could add something as you're discussing where you want to focus in. And so once you pick one of those behaviors, then you start to do your ORS skill with the spirit and see where that leads you during the gentle guidance. I do want to spend a minute talking about change talk versus sustain talk. So change talk being when we hear our patients talking about why, so we call it darn cat, but change talk is desire, ability, reasons, and need, darn, and then commitment and taking steps. And so there's a real difference between those two pieces. We want to listen in to hearing our patients talk about, why, the whys they want to change. Like, I want to change because I think it'll do this for me. Or the confidence, I think I could do these things and that might make a difference. And the reasons, which play into values as a parent, as a healthy person. And then the needs, I really need to get those labs down to where I'm more comfortable, and as my physician, that you're going to feel more comfortable and confident in my health. So we're listening for change talk. And then we try again with gentle guidance to move to commitment and taking steps. And we think this is what leads to behavior change. And I wrote a note to myself that the whys, or the desire, ability, reasons, and needs, then become habits when we put behavior change in place. So that's what we're really aiming for. So if you're not hearing the change talk, one of the things that you can do is bring it up by asking questions. So desire, how might you want to change your eating? Or ability, how would you go about making changes in your eating? Or how could you? Reasons, what are your reasons for making changes? And need, how important is it for you to make these changes? Sustained talk basically would be a person talking about maybe how hard it is to change. Like, I'd really like to change, but it's so hard. And the spirit and skills of MI, we could apply, we want to be empathetic. We definitely want to put empathy in that. And as good providers, that's part of what we do. But if we continue to be empathetic, we might not ever get to a part of gently guiding to change. So for example, if I could continue to say, yes, it's so hard, you're right, change is so difficult, and believe that, but it might not lead the person or help lead them to the change that they can make that would improve their health. So my response, focusing more on change talk rather than sustained talk, is going to make progress happen, or help that person make progress. The other thing we can do is explore goals and values. So really thinking about roles as a parent. So as a parent, I want to, help my children be as healthy as they can. And I want to set some goals and values that mix with that well, that create that. What is the part that it could be about fitting into those clothes that everybody else is wearing. I see that a lot with the teens. They might not be so focused on health issues, long-term health issues. So really figuring out what works for them and using that information to think about how health behavior can change for them. One of the things that is also helpful in making change is, or a specific change, is once you get to the point of where they've decided, here's what I think I'm going to do, and they share with you their idea, or I'd like to change this, you can ask how important it is and how confident they are that they can make the change. So what I often see is when I ask, how important is it for you to make this change? They're going to tell me 9 or 10. It's usually pretty high. But when I get to confidence, that's where they rate themselves a bit lower. And that can start a conversation about the barriers. So what do you think is going to get in the way? This is really important to you, but you're not very confident that you can make it happen. So what things could we talk about or problem solve that might be able to change for you? And then just a few more slides and I'll be done so we can answer questions and talk more. But emphasizing personal choice, really making it up to the person. Once again, the changes within them, they're coming to you. They want hopefully to work on health like you do. And but talking to them about when you decide that you're ready to make these changes in your eating, you will know what to do and be able to put it into action. Once again, this is if the person has told you this. So you're just affirming their personal choice and what they've said to you. You're taking time to figure out what works for you and how you can fit this into your day. You can also discuss pros and cons. Like, how does your weight get in your way, if at all? And if you made these changes in eating and activity and lost some weight, how would that benefit you? What would it look like 6 months down the road if you put this into place? And then rolling with resistance. So oftentimes people are not confident about change. And I think that's where we get what we call resistance, but it's just that confidence difficulty, and something in aligning with them and saying something like, it sounds like you've thought a lot about the things that could get in your way, but what could be a possible solution? So really try to getting them to think of the solutions rather than the barriers if possible. And this is also a place where you could offer information about ideas. The final piece that I'll talk about is closing the plan. So if a person's not really ready to change, once again, we hope that you've created that relationship where they're going to want to come back and talk to you when they are ready. So you just have a honest conversation about, it seems that you're not really ready to make the change at this time. And can we set an appointment up for 2 or 3 weeks, a month, to further talk about this and see if you're in the same place? If they're more ambivalent, you can talk about strategies that have worked for other families or other patients. So here are some things that have worked for other people that I've talked to, and which do you think might be best for you? What are you willing to try? You really want the person, even if you offer the menu of choices, you want the person to pick the things that they think will work best for them. And then if ready to change, you're in good shape. They're in good shape because you've done motivational interviewing, and it sounds like they have some pretty good reasons to change, and they'll be ready to do that. And so you talk about next steps and how you're going to follow up. And those are all the slides I have. So I'm going to stop sharing, but I really appreciate being able to spend some time talking about that. And I'm happy to spend some time thinking about it and answering questions as they come.